Assalamu alaikum. Good day to all of you, dear doctors. Today I am going to discuss an important topic for MRCS Part A examination. The topic name is carpal bones. I think this topic is very familiar to all of you. It's known to all of you that the wrist is comprised of 8 carpal bones, which are arranged in two rows of four. Four bones are in each row. It is convex from side to side posteriorly and concave anteriorly. As the diagrammatic image of carpal bones are, let's find that which is the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Here's the posterior view, and it is the anterior view. It's known to all of you that no tendons are attached to scaphoid and lunate and triquetrum. These bones are stabilized by ligaments. Uh, Pisiform is a sesamoid bone arising from the tendon of flexor carpi ulnaris. That's the pisiform, which is sesamoid bone and which arises from the tendon of flexor carpi ulnaris. And now I'm going to share a brief idea to you about scaphoid bone. Here's the details of scaphoid bone. The scaphoid has a concave articular surface for the head of the capitate, and at the edge of this is a concentric surface for the corresponding area on the lunate. That's the surface for a lunate. Proximally, it has a white convex articular surface with the radius of the articular surface of radius. It has a distally sited tubercle that can be palpated. The distally sited tubercle here, it can be palpated. The remaining articular surface is to the lateral side of the tubercle. The lateral side of the tubercle. It faces laterally and is associated with the trapezium and trapezoid bone. The narrow strip between the radial and trapezial surface at the tubercle gives rise to the radial collateral ligaments. Now I'm going to discuss an important topic, that is blood supply of the scaphoid bone. This is from the scaphoid tubercle vessels. The scaphoid tubercle vessels that comprise 20% and the dorsal wrist vessel that supply 80%. Here's the volar branch, which supplies 2 to 30% of blood supply, and dorsal branch supply 80% of blood supply. The scaphoid is anatomically divided into three parts: the proximal pole, wrist, and distal pole. It is important to appreciate the blood supply to the scaphoid, which is by branches of the radial artery. Blood space from the radial artery. The dorsal branch of the radial artery, which supplies 80% of the blood. Dorsal branch is the dorsal branch which supply the 80% of the total blood supply, and which enters in the distal pole, which enters into the distal forms and travels into a retrograde fashion towards the proximal pole. So you'll find that this artery enters into the distal forms and then enters into the retrograde and travels retrograde fashions toward the proximal pole. Consequently, fractures can compromise the blood supply, leading to avascular necrosis and subsequent degenerative wrist disease. The more proximal to the scaphoid fracture, the higher the risk of avascular necrosis. This information is so much important that the blood supply of the scaphoid bones, which is from the radial artery and dorsal branch of the radial artery, supplies the 80% of the blood supply, which enters into the distal poles and travels into retrograde fashions. As a result, avascular necrosis occurs in the proximal pole. So the more proximal to the scaphoid fracture, the higher the risk of avascular necrosis. I think now I've got a brief idea about carpal bones. Thanks for watching my videos. Thank you all of you.